Did you know that smoking tobacco is one of the causes of most lung diseases? Join me as I discuss this further in this upcoming episode. Stay tuned. Lung disease refers to many disorders affecting the lungs, such as asthma, COPD, infections like flu, that's influenza, pneumonia, tuberculosis, lung cancer, and many other breathing problems. We will be focusing on COPD for this episode. Now, COPD stands for chronic obstructive pulmonary disease and is the third leading cause of death worldwide, causing 3.23 million deaths in 2019. Nearly 90% of COPD deaths in those under 70 years of age occur in low and middle income countries. COPD is the seventh leading cause of poor health worldwide, and tobacco smoking accounts for 70% of COPD cases in high income countries, whilst in low and middle income countries, tobacco smoking accounts for 30 to 40% of COPD cases, and household air pollution is a major risk factor. Now let's talk about symptoms here. Several processes can cause the airways to become narrow and lead to COPD. There may be destruction of parts of the lungs, mucus blocking the airways, and inflammation and swelling of the airway lining. Hence, the most common symptoms of COPD are difficulty in breathing, chronic cough, sometimes associated with phlegm, and feeling tired. COPD symptoms can get worse quickly, and they are called flare-ups. They usually last for a few days and often require additional medicine. People with COPD also have higher risk for other health problems, and this include lung infections like flu or pneumonia, lung cancer, heart problems, weak muscles, brittle bones, depression, and anxiety. COPD develops gradually over time and often resulting from a combination of risk factors, and that include tobacco exposure from active smoking or passive exposure to secondhand smoke, occupational exposure to dust, fumes, or chemicals, indoor air pollution, or coal that is frequently used for cooking and heating in low and middle income countries with high levels of smoke exposure. Early life events such as poor growth in uterus, prematurity, and frequent or severe respiratory infections in childhood that prevent maximum lung growth. Asthma in childhood and rare genetic conditions which may cause COPD at a young age. Now, how do we investigate for COPD? Diagnosis is confirmed by a breathing test which we call spirometry, which measures how the lungs are working. But in low and middle income countries, spirometry is often not available, and so the diagnosis may be missed. In terms of treatment, COPD is not curable, but can get better by not smoking, by avoiding air pollution, and getting vaccines. There are several treatments available for COPD, and the main treatments are inhaled medicines, for example, inhaler, that relax the airways to keep them open and reduce the swelling in the airways. These inhalers can be short-acting, meaning that it starts to work in seconds and can last for 4 to 6 hours and are often used during flare-ups. There are long-acting inhalers that take longer to start working but last longer, and these are taken daily and can be combined with inhaled steroids. Other treatments may also be used, for example, steroid pills and antibiotics. They are often used to treat flare-ups, which are often caused by respiratory infections, and nebulized treatment may be used as well. Oxygen is used for people who have had COPD for a long time or have severe COPD. And we have what we call pulmonary rehabilitation, and this kind of teaches exercise to improve your breathing and ability to exercise. Surgery may improve your symptoms for some people with severe COPD. Now, inhalers must be taken using the correct technique, and in most cases with a spacer attached to the inhaler to help deliver the medicine into the airways more effectively. Inhaler technique is essential towards your management. Hence, I found a useful guide on the Canadian Lung Association website, which demonstrates appropriate way to use your inhaler with a video according to the type of inhaler you use. For example, if you use the blue inhaler for the Ventolin, there is a video for Ventolin on how to appropriately use Ventolin inhaler. I will leave the link below so that it will take you straight to their page. Alright, how do we live with COPD? Lifestyle changes can help improve your symptoms of COPD. Let's start with quitting smoking or vaping. This is the most important thing you can do. Even if you have been smoking for many years, quitting can still help, as reducing tobacco exposure is important for both primary prevention of COPD as well as disease management. Avoiding secondhand smoke or smoke from indoor cooking fires. Stay physically active. Protect yourself from lung infections. Get flu vaccines every year. Get pneumonia vaccine. And get all the available COVID-19 vaccines, and make sure you have had the latest boosters. It's important as well that you know about your condition and the treatment and how to look after yourself in order to stay active and healthy as possible. Now, if you're looking to quit smoking, making a quit plan can improve your chances. Now, what is a quit plan? A quit plan is a set of steps you can use to prepare your next quit attempt. And it will help you think through the challenges and how to overcome them. And if you've tried to quit in the past, you can still use what you've learned in the past to help make this quit attempt successful. So let me walk through the 7 steps together with you. All right. Step 1. Clearly state your reason for quitting. When I talked about the weight loss, I did mention, what is your why? Is it for your health, your family? Being reminded of the reason can help keep you motivated. Step 2, identify your concerns. What are you worried about? And how you can deal with your concerns. Think about any concerns you might have and how you can deal with them. Let's say, for example, you are afraid that it will be hard. You could plan to ask someone you trust for support. Are you concerned about withdrawal symptoms? You might want to call your doctor, or you might want to go to the smoking cessation clinic that's close to you, or you call the Quick line. Alright, there will be numbers in the comment section below, especially for those of you in Canada. Alright, step 3, identify your triggers. Is it stress? Seeing others smoke? Do you smoke during your coffee break? Understanding where and in what situations you smoke will help you prepare. Alright, step 4, plan your response to cravings. When a craving hits, it will be easier to resist if you have a strategy in place for what to do instead. Some people may go for a walk, others might grab a healthy snack. Now, we have nicotine replacement therapy and other medications that can help to reduce the frequency and the severity of your cravings. Alright? Step 5, decide your overall approach. How would you approach quitting smoking? you will need to decide how you want to quit. Combining the right tools and the support can give you the best chance of success. If you've tried quitting before, what helped? What didn't? What would you do differently? Will you cut down over time or stop smoking all at once? Will you do it on your own, or you're going to get help from friends, family, or from your family doctor or smoking cessation clinic? Will you use approved quit aids such as prescription medication, nicotine patches, or gum? Step 6. Choose your tools and forms of support, i.e., again I've said, would you be connecting with a quit coach, smoking cessation clinics via your local pharmacies or drugstore, or via your family doctor? Alright? Step 7. Set a quit date. Pick a quit date. Give yourself enough time to prepare, but don't put it off. So these are the 7 steps or the basics of a quit plan. The next thing I would like to discuss is the benefits of quitting. Quitting smoking is the best thing you can do to improve your life and your health. You will start seeing health benefits soon after your last cigarette. Now, within 20 minutes, your blood pressure drops to a level similar to what it was before your last cigarette. Within 8 hours, the level of carbon monoxide, which is toxic gas in your blood, drops to normal. Within 24 hours, your risk of having a heart attack starts to drop. Within 2 weeks to 3 months, the airways in your lungs relax and you can get more air into your lungs and breathe easier. Within 1 to 9 months, you cough less and your lungs even work better. Within 1 year, your added risk of heart disease is half of that of a person who smokes. Within 5 years, you have the same chance of having a stroke as someone who has never smoked. Within 10 years, your chance of dying from cancer is much lower. Within 15 years, your risk of heart disease is similar to that of someone who has never smoked. Now, even those who have developed smoking-related problems like heart disease or cancer can benefit from quitting. Compared to continuing to smoke, people who quit smoking after having a heart attack can reduce their chances of having another heart attack by as much as 50%. Now, for those of you in Nova Scotia, I will leave a useful QuitSmoking contact numbers and the link to tobacco-free Nova Scotia website in the comment section below. It's giveaway time. Okay, who wants to stop smoking? I have 5 $10 gift card that was kindly donated by PharmaSafe, located at 1624 Sackville Drive, Middle Sackville. Now you can use this gift card to treat yourself to anything of your choice in store. Not buy cigarettes. Please text #Stop Smoking Dr. Agnes in the comment section below for a chance to enter the draw to win a gift card. Now the lucky winners will be contacted directly for an arrangement on how to pick up your gift card, or it can be mailed to you. Alright, good luck. I hope today's topic was useful and engaging. Please post your feedback and comment below, and kindly follow Talk with Dr. Agnes on Instagram, Facebook, LinkedIn, and subscribe to my YouTube channel. Like and share this video with someone you care about that would benefit from quitting smoking, and I look forward to connecting with you all. Now, for general inquiries about our web series, or you would like to partner with me regarding health promotion concepts, please contact us via email with talkwithdragnes@gmail.com. Until then, continue to strive to become a healthier version of yourself, and I'll see you soon.